So thank you again for joining us for another Distance Learning Week session. Glad to see you here and glad to have Leah with us today. So I will go through a couple housekeeping things and introduce her. So we do ask that you keep your microphones muted just for the quality of the recording, and then certainly we'll open that up afterwards for some Q&A with our presenter. And then all of the information, recording slides, all of that will be shared with you at the end on a quick bit.ly link so that you know how to get to that. So this is Dr. Leah Wentworth, and she is the inaugural Director of Student Wellness at SUNY System Administration, a very important role, and we're excited to have her. She coordinates a wide range of mental health and wellness projects at System, which includes serving as a principal investigator on the Garrett Lee Smith Suicide Prevention Subaward. And she has a BA in Community Planning from the University of Massachusetts, Boston, an MPH in Health Policy and Management from the University of Massachusetts, Amherst, and her PhD in Occupational and Environmental Health from the University of Iowa. And Leah is going to be sharing with us about SUNY's mental health initiative.
Right. Everyone should be able to see this. Are you looking at? Let's see. Let's get it into slideshow. There we go. All right. So I figure we'd talk about 15-20 minutes worth around mental health, some of the great initiatives that we're doing, but have time for questions, concerns, answers, ideas, which is always my favorite part of any presentation, hearing from the great people doing the work. So first, I think there is a challenge with mental health in the college environment that has been increasing even before COVID. We saw within SUNY and then nationwide, there is an increased request for services of all types: counseling, psychiatry, supportive services that aren't counseling but that support mental health. But we also saw an increasing complexity in the mental health needs of students being served within SUNY and elsewhere. That includes more complex mental health diagnoses. That includes more students coming in with a mental health disability, formal documentation of that, more medical withdrawals for mental health. So the combination of increasing requests at all and the fact that there is more complex needs of the students that are being served certainly presents a challenge before COVID even occurred. The impact of COVID certainly had a few specific pieces that affected mental health within students. So initially, students were reporting increases in anxiety, both as a function of COVID, but also more generally around economic and academic instability, not being sure what was going to happen with their career, with their academic progress, and then seeing more depression as a function of isolation. Certainly that was true in spring and summer. Some nationwide statistics on mental health in the college-age population saw dramatic increases in depression, but also in serious thoughts of suicide within this population, more than a twofold increase over studies done 2 years ago. So meaningful increases in thoughts of suicide. And at the same time, beyond this age population, we're seeing that there are coping mechanisms for mental health concerns that aren't necessarily healthy. You may have seen the article from this week in the Post looking at drinking behaviors as a function of COVID. This was not an age-limited study. This is across all age groups, but saw increases in days drinking beyond healthy limits, and then days binge drinking. And the presence of having children in the household was going to increase those numbers significantly, as well as being female or a person of color. So many individuals are using alcohol as one way of managing day-to-day responsibilities that have dramatically changed since the beginning of the pandemic. So System has a few strategies related to mental health support. And again, it starts with the great work that occurs on campus. Our job is to help the helpers. So first, of course, the counseling centers are often the front line in terms of supporting mental health care specifically, but they also do some great work in terms of health promotion. We are always looking for ways to support them with new programs, strategies, ideas. We also look at system-level solutions around mental health promotion and wellness strategies, and that includes things like training, like sharing best practices, like developing and sharing marketing campaigns. You may have seen #ReachOutSUNY that launched this fall. And we also look for ways to promote professional development for our faculty and staff on campus that are engaging with students, recognizing that there is an opportunity for everyone, regardless of whether they're a clinician, to help support mental health. And at the same time, we do have an obligation to ensure that our faculty and staff are staying mentally healthy themselves. So one of our signature initiatives specific to clinical care is the Student Telecounseling Network. This started with 4 campuses and 1 clinical provider. And the intention was really to offer a couple kind of specific clinical pieces. The primary clinical service within the telecounseling network is telepsychiatry. Psychiatry is one of the greatest challenges clinically for our campuses because there's, in general, a dearth of psychiatric providers in New York State and nationwide. There just aren't enough providers to go around. And certainly in the college setting, there's an increase in requests for these kind of services. So the Student Telecounseling Network is a fabulous way of addressing this without forcing campuses to hire a per diem or full-time provider. They're initially seen by the counseling center, they're referred for care, and then the care is managed through the online platform for as long as is needed. So as soon as they're stable and can be referred back to campus, they return to the counseling center for follow-up and medication management. It is not meant to replace crisis care. It is meant to augment the existing care provided within the counseling center. And at the same time, the counseling centers can also receive consultant services from upstate. So if they've got patients that they're feeling pretty confident about, but want to briefly consult with another physician or psychiatrist or psychologist, they can certainly reach out to Student Telecounseling Network practitioners. Upstate Medical University is our clinical provider, and depending on the referral process, it is completely optional for them in terms of when they actually use the care. And at the same time, we're also very excited to mention that there is a second clinical site coming on board this fall, Downstate Medical in Brooklyn. One of the pieces that's interesting is it's a year-to-year appropriation, and so our campuses have expanded as a function of a couple things. First, that there's a projected need for services on campus. They also have needed to have a prescriber available to manage medication once students are in the telecounseling network, just to make sure that if there are questions about medication management, that they can continue to be served by this. And we are currently serving 12 campuses. That includes both community colleges and state-operated campuses through the program right now. We expect to have 5 more campuses coming on board in the next few weeks. Some key facts about the demographics of the students that are served by this program. So one of the questions that we asked of students in the initial enrollment phase was, had they used the counseling center? And a lot of them, we were surprised, had not previously received mental health care. Certainly, if there isn't psychiatry available on campus, it would make sense they couldn't have been served in that way. But it is also interesting as we think about promoting mental health resources that exist on campus and making sure that everyone is aware of that. It's also worth noting that demographically, we saw a significant number of students that identify as gender and sexual minorities. So as we think about things like demisexual identity, bisexual identity, asexual identity, are our clinicians on campus appropriately trained to ensure that students can receive care specific to clinical questions relevant to gender and sexual minority status, just to make sure we're reflecting the diversity of our students and meeting their needs exactly where they are. So there are some challenges within the current model. For example, we're not talking about billing to insurance currently because there's so much diversity in terms of our insurance requirements across campuses. And there are a number of privacy protections we want to keep in place that billing for insurance may mitigate or make more challenging. The year-to-year appropriation structure makes it very hard for us to think about a sustainable scaled model across system. And so I think one question, a big question for ourselves and for leadership is going to be, what is the vision for the next phase of this program? For campuses that don't have counseling centers, the model just doesn't serve their needs. That initial referral phase is contingent on having a clinical mental health provider available. So how do we think about some of our smaller campuses that don't have that provider as the first step? And how do we at the same time ensure the safety of all of our student participants, because that is our first consideration. So I think we're excited about what's happening with this program, and at the same time we recognize there's some room for growth and exciting opportunities in the future. As of this week, we're excited to mention ThrivingCampus, which is an app that that facilitates students' connections to other mental health providers off campus. There's no cost to campuses or students, and it's free for providers to be listed. They can search based on location, and a lot of providers are still providing care entirely online, so that may not be of interest. But they can also search based on practice area, for example, social work, psychiatry, psychology, or interest, for example, men and masculinities. And we're excited to announce that this onboarding process began this week. So we're just starting to reach out to campuses to identify the key contacts who can go ahead and get them into this campus. And this is going to be available for the next year for no cost to students or campuses. We're excited to announce that we've expanded Middleearth, which is a program that began at UAlbany several decades ago. And you may catch the reference, Middleearth is a reference to Lord of the Rings for any Tolkien fans. It's a peer-to-peer networking opportunity for students. These are not trained counselors, but they are supportive and they are available for students to kind of unpack any concerns or questions they have. The hotline runs 12 to 12 Monday through Thursday, and then it's 24/7 over the weekends. The number is listed there, and it is a great resource for students that don't need clinical care or are not in crisis, but do want to have some support and want to talk to somebody about concerns, whether that's personal or academic. So they've been doing a great job serving the UAlbany students and have recently expanded to serve all of the SUNY students. One thing we're very excited to talk about is our Garrett Lee Smith Suicide Prevention Grant, which is a 5-year award from the Office of Mental Health. And this is awarded to states, tribal nations, and college campuses. We are part of the sub-award from Office of Mental Health. It is a state award. They are required to designate an institution or institutions of higher education as part of the award, and we are the designee. And that means that we get $45,000 a year for 5 years, and all of the activities are open to SUNY students, faculty, and staff, and it really is taking a public health approach to suicide prevention and thinking about mental health promotion and the structural barriers to help seeking that can get somebody to the point to ensure that they're not going to be at risk for suicide, as well as promoting healing after suicide occurs in a campus or community. So one of the initiatives here is our Question, Persuade, Refer training, QPR. It is available for free online at our mental health page, and that's appropriate for students, faculty, or staff. It teaches somebody how to identify someone in crisis and get them resources. It teaches folks how to safely engage, how to engage with somebody that is maybe reluctant to seek help. And for now, all of the training for this is available online exclusively. We will eventually offer it again in person. It takes about an hour to complete the training, and it's a really robust, engaging way. It gives you the chance to practice too how you actually talk to somebody. Having conversations around suicide are very difficult. And so the chance to role play is really helpful in this training process. Crisis Text Line is another resource that we're promoting. It helps move somebody from a crisis to a cool calm. We have a New York specific keyword, and we branded SUNY specific marketing materials for any campus to download and customize as they like. We've also identified subgroups of interest that speak to populations we know that may be at enhanced risk for suicidality or death by suicide. And recognizing the diversity of SUNY system, we've really looked for those opportunities to highlight those populations and make sure that we're reflecting the diversity and those groups' needs. Here's one example of the kind of marketing material that's been put together by Crisis Text Line, by OMH, and by SUNY, and we're continuing to develop robust and diverse materials relevant to this resource. One thing we're completing this year, certainly a heavy task, but a valuable one as we think about the challenges on campus, is Postvention Protocol. Postvention is a structured response to a suicide that helps facilitate healing in a campus and a community, and it helps prevent, to whatever extent possible, the risk for contagion of suicide. We certainly know that suicide can impact our campuses, our communities. We've seen suicides at SUNY system, across the system, and we're looking to understand how campuses are effectively responding in the event of a suicide. How are they communicating with the campus and the community? What does safe messaging look like? And identifying those uniform standards for best practices, just to provide a resource to campuses when the unthinkable happens, to make sure we're all able to be prepared. Excited to announce that there is a virtual convening on mental health in the changing higher education landscape, also funded by the sub-award. It is free for any SUNY-affiliated students, faculty, or staff. It also includes continuing education credits in a range of groups that includes CHES, social work, CME, psych credits. So again, those are all free, and the entire content is available for anyone affiliated with SUNY at any time for free. It includes formal presentation sections on things like medication management, but also informal discussions on things like structural racism as it affects mental health care and access to care. So we're excited to have such a robust calendar available. We've already seen almost 100 registrants, and we've only had registration open for 3 days. So I think there's a lot of interest in this specifically. We're doing some work with OMH around help-seeking behavior. This is not funded by any grant or activity. This is just driven by a few of us who have been working together to understand barriers to help-seeking. And we've found a few kind of key facts here as a function of these engagement strategies. Certainly, there are still structural barriers for students to access mental health care. Scheduling is certainly a concern. There's also still a perception for students that many of their concerns or their state of mental health, they don't think rises to the level that needs clinical mental health care. So I think there are still some barriers in terms of perception that we're working to address. And this is a multi-phase project. Some of the work has already been completed. Some is on pause, but the next group we're seeking to engage with is actually medical students, which is a group that may be at additional risk, but certainly as they're becoming part of the next generation of healthcare professionals, we think it's important to make sure that they're getting access to mental health care. And finally, talking about the Student Mental Health and Wellness Task Force. So this was initially convened by the Provost's office. Todd Larson is deeply committed to this issue. And we've had representation from state-operated, from community colleges, from counseling centers, student affairs. We have state and national experts functioning as part of the team. The work has been paused since the spring of 2020 and is just now resuming. And there are a handful of key activities that are a function of this work. First, to understand a menu of best practices relevant to public health informed mental health work. To establish guidelines for mental health service delivery and think about what our standards are for things like staffing ratios, hours of operation, et cetera. And then thinking about technical assistance and professional development opportunities, as well as seeking funding opportunities for mental health, knowing that this is an area that will continue to need attention and that we're going to need to seek support at the state and federal level for if we're looking to serve all of the needs on campus. So at that point, I will pause. I think there were chats. I'm not great at doing 3 things at once. So the webpage is up there. And Camille, relevant to Thriving Campus, all of the campus's VPs for Student Affairs received that information on the campus app, and it has been trickling down to the folks that will be identified as the key contact. The next step for the key contact for Thriving Campus is a series of webinars. We're going to be having onboarding webinars for them to understand what happens, what are the technical changes they should make to their webpage so that students are using the service, thinking about provider identification and making sure that the registry is up to date, any technical problems. But that webinar series, we expect to start next week. I'll confirm with the CEO of Thriving Campus today or tomorrow what the dates will start, and we'll have a series of them. It's not going to be 1 or 2. We expect this to be a several-week process, but we would also love before the end of the semester to have this going and functioning effectively for students.
Yeah, and I think that's really timely too for the holiday season as well, to have something like that up and running, and the breaks between semesters and maybe students going home and not, having that support. So it's a great tool for this time.
Yeah, we're very lucky that there was an interest to have this commitment, and this really comes out of the Chancellor's commitment to mental health. This was announced at the beginning of October and happened very quickly in terms of accessing these resources and making it available. Yeah, so I'm excited to announce this. And question about faculty getting access to resources. So question, persuade, refer is available to faculty for sure. Also, the virtual convening and the credits that go along with that also available. Thriving Campus, unfortunately, is at this point only for students to access. And that's, we can certainly see how it's utilized in the first year because this is the first time we've had a system level purchase. Likewise, Middleearth is not really driven by faculty and staff engagement. It is a student peer-to-peer model. And as far as crisis text line, that certainly is available to faculty and staff if there is an interest. Likewise, Project Hope, which is an OMH hotline, as opposed to a text line, which seems to be more interesting, appropriate for student population. Project Hope is certainly available to anyone in the state of New York, and that hotline can be called 24/7. So I think we want to be aware of those kind of national and state resources that are also available to them as well.
And that's a great question for faculty resources. We've also posted on our COVID response site at the very top, there's a hotline for anyone for New York State. So that's the service that was sent out from the governor's office.
Yes, exactly.
I also had a quick question about community resources. So, you know, I know you went through how the services were provided and the support from downstate, but I'm just curious, like, if you employ the community resources to connect students to anything, you know, if they're going to a campus outside of where their home might be, are you able to still connect them with resources locally?
That's a great question. And certainly Thriving Campus is designed to help connect, not even just in New York State, anywhere in the country. So we certainly have students that may be living elsewhere now or permanently. And so that app is helping facilitate care wherever they are and however they can receive it. At the same time, you know, I think we recognize there's a lot of great community level resources, and some of our campuses certainly have very strong relationships with those community providers. I think we're always looking for ways to improve the community connections. I know there are some structural barriers to those things that we're working on with some of the new folks that have come to system in the past few months. So I think we recognize there's some great work occurring, but there's always room for improvement in this state.
Yeah, great, good. I'm excited about this app.
Yeah, I think it'll be great, in part because being able to look on things like practice area or interest. If you've got, say, you're looking for treatment for an eating disorder, for example, that is not necessarily something that every counselor or psychiatrist has expertise in, but it may be essential for somebody as they're looking to receive care quickly. So I think that's awesome. And the fact that you don't have to be looking at providers and seeing which ones are available, because the provider can determine whether they're accepting new patients or not in the app itself. So if they have availability and they're listed, they're in there. If they're not available, they're not going to be. They can hide their listing. And so I know one of the challenges for students, or certainly anybody that's seeking mental health care, is that referral process where you're trying to get care, and it's overwhelming to be on Google and trying to find somebody to help support your mental health care. So being able to have that barrier removed and to be able to enhance the way that people are seeking care, I'm really excited about it.
Yeah, that's great. Good question. Will the campus know some analytics about the app?
What an awesome question. So I admit to being secretly a data nerd, and this was one of the first questions that I asked when I said, you know, we're looking to onboard this first system level. Absolutely, the campus will be, and I think we're also looking to do midstream indicators to understand, for example, is a campus just not seeing any referrals? Because there's a few different ways that a student at a campus can receive care. They can themselves search for and engage with providers. But a counseling center can also refer a student to the app and make recommendations in terms of, like, this as provider I know is exactly what would be beneficial for you. So I think one of the things that we can do is see that process. Are we seeing a number of contacts made as a function of this app? How effective is the referral process from the counseling center? So are we seeing that referral to a student being turned into an engagement with a provider? That, to me, I think speaks to if there are still structural barriers to receiving care. Number of provider engagements is certainly something I'm interested in, and regional ways of describing that as well. Also, are there gaps in practice areas we need to address kind of midstream? For example, are there fewer clinicians that are working within motivational interviewing as one technique, for example? So are we identifying those folks who have the clinical skills that our students want, and how effective are we in making those connections? So I'm hoping that we're going to see a few different chunks of analytics, both in the middle of the contract and closer to the end of it, to determine what is the best next step. Because while we're excited about this product and this process, we're not beholden to them. So if it's not working for our students, we're not going to just keep this going on forever.
Right, absolutely. Good. Other questions?
There were a lot of good questions, Camille.
Yeah. And thank you for the background too. I mean, I think that information is important. We've kind of always known, right, about a need, but certainly with COVID, it's risen to the surface, I think, for more of us that aren't involved in that every day. And so we're seeing more, we're hearing it from our faculty, or we're seeing it from our students, and knowing about this work that's out there, being able to connect the dots for people is so important. So just this awareness, I think, is, you know, it goes very far. So.
You know, I think I keep saying I have the best job in the building. I'm such a lucky person to work with such interesting folks and such essential and foundational work in terms of our student success and persistence. But I think it's also one of the things that we continue to struggle with is promoting resources and ensuring they're being used by everyone when they need them. Right. So looking for new ways to identify diverse providers, to think critically about how we're facilitating mental health support the way we would other health. Does a sick day change for mental health reasons versus physical health reasons? And if it doesn't, are we ensuring that folks feel empowered to use their sick time appropriately? Some of these structural conversations that don't have easy answers, I think are part of the future around mental health. So thank you very much for letting me talk a little bit about the work we're doing and how we're doing it.
Absolutely. Thanks for joining us. I'll just wrap us up here then. So in addition to today's presentation, there are several others that we've hosted already this week and will continue to host throughout the day today and tomorrow. You can view all of those at our bit.ly SUNY NDLW 2020. And we have a survey that we would love for you to take to help us inform future offerings and how we go about doing this every year. And of course, there are also events from the U.S. Distance Learning Association. These are global events, and SUNY is listed among them, so that's very exciting. So again, thank you to Leah, and thank you to our participants. I wish you well, and I hope to see you at another event soon.
Awesome.